growing up in Canada. I was born and raised in Steamville, Newfoundland. Went to school there until I was 18. Then I moved on to the University of Toronto, where I did my undergrad in chemistry. And finally, I did my DDS in Washington, D.C. at Howard University. Came back to Toronto, where I got married, and eventually settled there and continued to practice there 20 years later. It was a tough journey for them, for sure, but that instilled in us the drive to work hard, the drive to make society better for the next person, and as well, to do well for yourself and to do something that you're proud of at the end of the day. And I think that's the kind of background that knowing what your parents went through kind of instills in you to move forward with. I graduated in 1999, came back, started practicing in Ontario, in Mississauga. There was always a drive to learn more, and that's where the continuing education element came into play. We want to provide our patients with better care, better treatment options, and continuing education was a way to do that. It also developed our skills where we can be quicker and faster at what we do. And so continuing education became almost a passion, if not an obsession. I know in my first couple of years, I racked up almost 500 or 600 hours in continuing education. And that helped me significantly in preparing to go out on my own, to start my own practice, to start giving back through teaching, and then as well, start giving back by getting involved in places like the Academy of General Dentistry, the Ontario Dental Association, the Canadian Dental Association, and the Royal College of Dental Surgeons. These are great organizations. They protect our profession, they protect the public, and being involved with them is a learning experience on its own. We have now at the AGD started moving courses into smaller capsule-like courses, pearls. So in a morning segment, you will have 8 to 10 speakers come in and basically give you the pearls of their research. So now you have literally bullet points towards learning, instead of spending an entire day in the classroom going over all the research and the history behind what the salient points are. So I think that is the key element, and we need to be on the forefront of that because we need to make sure that the dentists are trained, they continue their training, they stay current, and provide the best possible care for their patients. So that is of paramount importance. AGD was a little silent about 15, 20 years back. And then, slowly we started getting more speakers, more continuing education, and because of the programs we were offering and the high quality of CE we were offering, we started getting more membership, and our membership numbers started driving up here in Canada. We started doing more social events. There used to be a time where dentists don't even talk to each other, and we wanted to change that. And we successfully did that by introducing things like evening events, cocktail receptions, and our gala that the AGD has every 2 years. We also have excursions. We just recently did a continuing education program in Jamaica with 40 people in attendance, families. So we want to kind of close that gap between practicing dentistry and social elements and family. Practicing dentistry is a very, very tough business. Patient expectations are literally ridiculous in today's day and age. They can't even be achievable in certain situations. regulations are becoming onerous, from payroll to infection control, record keeping, HARP certification. You know, this is a full-time job on its own. It's becoming very, very difficult and very, very stressful practicing. And you need to be able to get out there, talk to another dentist, and understand that you're not in this boat by yourself, that the same situation is happening in everybody's backyard. And then when you feel that, you feel a little bit better. And you know what? It's not just me. It's not just my implant that failed. Maybe it's the type of implant you're using. That mistakes happen, that things do not always work the way they were planned to work. And ultimately, it just gives you that psychological therapy when you're with colleagues that understand where you are. Basically, I will be taking on the role of president in November of this year. And then after president, will be immediate past president. So by 2020, I should be ready to retire from the AGD. But I think locally we'll still be actively involved, you know, helping dentists socialize, learn, and enjoy.